Hello, future doctors, and welcome to The Explainer. If you're getting ready for your exams, you are in exactly the right place. Today, we're taking a high-yield deep dive into hookworm infections. Trust me, by the end of this, you'll have all the key concepts and memory tricks you need to absolutely nail any question on this topic. Let's jump right in. So here's our game plan for today. We'll start by meeting the culprits. Then we'll follow their crazy journey through the human body. After that, we'll learn how to spot the signs and lock in a diagnosis, cover how to manage it, and then we'll wrap it all up with a super fast revision round. It's the perfect roadmap to mastering this parasite. All right, first things first, let's get to know our subject. What in the world is a hookworm? And, more importantly, who are the main players we really need to worry about for our exams? Okay, let's start with the core definition. A hookworm is an intestinal parasite. Specifically, it's what we call a soil-transmitted helminth. But here's its clinical calling card. The one thing you absolutely, positively must link with it for your exams is iron deficiency anemia. That connection, it's the absolute center of this whole story. Now, it's not just one type of hookworm. We're really dealing with two main species here. On one side, you've got Ancylostoma duodenale. We call this the Old World hookworm, and it's more common up in North India. Just think of this one as the more aggressive of the two. And on the other side, we have Necator americanus, the New World hookworm. This one's more widespread, globally and in South India. You could call it the less bloodthirsty cousin. And I've got a mnemonic to lock that in for you. It's super simple. Ancylostoma is aggressive and ancient, which is our Old World worm. And Necator, well, that starts with N, just like New World. See? Easy points on an exam question right there. So why does all this matter so much? Well, because we are talking about a massive global health problem. Look at that number. Nearly 900 million people are infected worldwide. This is not some rare, obscure parasite. It's a major, major player in global infectious disease. Okay, now that we know who the players are, let's trace the parasite's incredible journey. How does it get from the soil into a person? And what is it actually doing inside our bodies to make us sick? Understanding this life cycle is really the key to its pathogenesis. This diagram here, it gives us the whole bird's eye view of the life cycle. And it's a pretty remarkable journey, right? It starts in the soil, finds its way in by penetrating the skin, takes a little trip to the lungs, and then finally ends up setting up shop in the intestine. To make this life cycle totally unforgettable, let's use the mnemonic SLIGS. It all starts with S for skin penetration. This is done by the infective L3, or filiform larva. Then it's L for lung migration, where it cruises through the bloodstream. Next is I for intestinal maturation, which happens after it gets swallowed. Then G for the gravid female, who lays thousands of eggs. And finally, S for stool excretion. That's where the eggs get back into the environment, ready to start the whole cycle over again. SLIGS. Now, what's really fascinating is how the adult worm causes anemia. It's not just one thing. First, it latches onto the intestinal wall with its buccal capsule. You can think of it as having teeth or cutting plates. Then it actively sucks blood. But it doesn't stop there. It also secretes enzymes to digest the tissue and, get this, releases anticoagulants. This means the little wound it creates keeps oozing blood even after the worm moves on. It's an incredibly effective blood-draining machine. And this chart illustrates that difference we talked about earlier perfectly. Just look at the numbers. A single Necator worm causes about 0.03 milliliters of blood loss a day, but Ancylostoma, it's all the way up at 0.2 milliliters per day. That is almost 7 times more. This, right here, is why we call Ancylostoma the more aggressive species. Okay, so we know what it is and we know how it works. So the next logical question is, how does this actually show up in a patient? And how do we as clinicians prove our suspicions? Let's dive into the signs and the diagnosis. The clinical features, you can actually divide them up pretty neatly. First, you've got symptoms from the migrating larva. There's ground itch, which is that classic itchy rash right where the larva burrowed into the skin. And sometimes you get a mild pneumonitis as it passes through the lungs. Then you have the symptoms from the adult worm living in the gut. That could be abdominal pain, diarrhea, and of course, the big one, the hallmark, iron deficiency anemia. Oh, and it's worth remembering that if Ancylostoma larvae are ingested directly instead of going through the skin, it can cause a special thing called Wakana disease with more severe GI and respiratory symptoms. And here it is. This is a classic exam question. What is the gold standard for diagnosis? It's simple, it's definitive. You demonstrate the characteristic hookworm eggs in a stool sample under a microscope. That's it. And this is exactly what you're looking for. Take a good look at this image. You can see those key features, right? It's oval-shaped, it's got a thin, clear shell, and inside you can see that segmented ovum, which has anywhere from 4 to 32 little blastomeres. It's a very, very distinct look. To make sure you remember these features, just remember the egg is classy. It's colorless, large, has an oval shape, a segmented ovum, a clear space inside, and it yields to salt, meaning it floats in a saturated salt solution, which is super useful for lab concentration techniques. Classy. You are not going to forget that. Diagnosis isn't just a simple yes or no. We also quantify the infection by counting the number of eggs per gram of stool. The WHO gives us these cutoffs for light, moderate, and heavy infections. And this is really important clinically because the morbidity, especially how bad the anemia gets, is directly tied to the worm birding. So we found the culprit. Now what? Let's move on to the final part of our clinical approach: treatment and, just as important, prevention. The treatment is really a two-pronged attack. First, you've got to kill the parasite. The first-line drugs are simple: a single dose of either albendazole or mebendazole. But you cannot forget the second part: symptomatic treatment. You absolutely have to address that iron deficiency anemia with oral iron and folic acid supplements. Killing the worm is only half the battle here. And prevention, it's all about breaking that life cycle we talked about. This means things like better hygiene, proper sanitation so feces don't contaminate the soil, and a very simple but incredibly effective measure: wearing shoes. That prevents the skin penetration. Then, at the community level, mass treatment helps bring down the whole reservoir of infection. And here is just a fantastic real-world example of public health in action. In India, the National Deworming Day Initiative gives out albendazole to children twice a year. This is a direct, large-scale attack aimed at breaking that very cycle of transmission we just discussed. All right, we have covered a ton of ground. Let's bring it all home with a rapid-fire summary. These are the absolute must-know high-yield facts for your exam. Okay, let's crystallize all this. Infective form, filiform L2 larva. Diagnostic form, eggs and feces. The key pathology, iron deficiency anemia. Gold standard for diagnosis, stool microscopy. First-line treatment, albendazole. And that key difference between species, just remember, Ancylostoma is the aggressive, old-world worm that causes way more blood loss. If you only remember a few things, make it these points. And that is it. You are now totally equipped with the essential, high-yield knowledge you need to tackle any hookworm question with confidence. We've covered the what, the how, and the why. So what's the next big parasite on your study list? Let us know what we should explain next. Keep up the amazing work.